we think about the First World War and its horrific catastrophes, we always think about bombs, soldiers' death, and amputated limbs. But these were not the only challenges that soldiers had to endure and face during those deadly years. The disfigured soldiers, unlike many others, were not seen as heroes by the society, but as disgusting monsters that caused a revolution with a fate worse than death. While many doctors abandoned them at their inevitable destiny, a young doctor and man decided to dedicate his efforts and years of war to mend their faces and souls. Harold Gillis. Harold Gillis studied medicine at the Cambridge University in 1900 and was admired by both the teachers and classmates because of his happy temperament and smiles. He wasn't afraid of a challenge. In fact, he was remembered by his friends as someone who did whatever he wanted to do. As many other doctors, at 13 years old, he volunteered at the Red Cross. His first stop was at the number 13 stationary hospital, where he met the French dentist Auguste Charles Valadier, who demonstrated to him the transformative power of plastic surgery and the strong relationship within dentistry and medicine. He took some procedures with him during his time in the war. One was destruction osteogenesis, which was a technique who created bones without grafting, and the importance of irrigate the wound before closing them. During his service at the Belgian Field Hospital and the Allied Forces Base Hospital, his interest and curiosity in this branch of surgery never vanished, but it developed into a strong passion that became his job during and after the war. On January 11, 1916, he became the chief of the new plastic unit at the Cambridge Hospital, where everything he thought should be done would have been done. He established a diet food of liquid foods and eggs because he thought that it was important to maintain the men's strength because they needed to endure a lot of painful and long surgeries. The incredible characteristic of Gillis' personality was his extreme care for the patient's soul and his capacity of see after the patient's disfigurement. In fact, he banned mirrors in his hospital because he thought that the wounded in the heart of the patients were very delicate, and mirrors could create depression in them and not faith in the recovery. In fact, after sensing that he needed to maintain some documents for the posteries, he started to draw by himself the procedures and then asked the help of the famous artist Henry Tonks, a 52-year-old artist with anatomical training, that needed to create pictorial representations of the before, during, and after of the patients to help them have faith in the recovery and in the process. In 1917, Gillis opened the Queen's Hospital at Sidcup, where collaboration was the key and the multidisciplinary team was the answer. One of the most important procedures he created was the tooth pedicle, a flap of skin that was attached to a protective infection oil-resistant cylinder, which the free end is then attached to the injury. This decreased very much the level of infections. Always during the treatment of the same patient, which is William Vicarage, a victim of flesh burns in the Battle of Jutland, Gillis innovated a pre-resistant technique that was the epithelial inlay by Hesser. He did the same thing Hesser did, except for the fact that he inserted the package outside of the wound. This way, the new healthy skin would unroll down and create eyelids for Vicarage's eyes. Plastic surgery for Gillis was a strange new art, where the surgeon was an artist whose job was to keep in his normal position what was normal and move to his original position what was moved and retain it there. After the war, during his private practice, he understood that to be a complete plastic surgeon, you had to master both reconstructive and cosmetic. In fact, in 1949, he was the first to do a successful phalloplasty. Gillies' work was a turning point in the history of medicine. In fact, today many people from all over the world can choose from an infinite number of procedures, both cosmetic and reconstructive, like for example the facial transplant of Katie Stubblefield in 2017. Thanks to his determination and his team's determination, now science fiction has the possibility to become science fact.